Hello, this is Dr. David Brady, Chief Medical Officer of Diagnostic Solutions Laboratory, and I'm here with a little clinical tip for healthcare providers on interpreting modern methodology lab results. GI-MAP uses quantitative PCR, or qPCR for short. It's the most accurate, most sensitive molecular technology. It's different than sequencing. And what it allows us to do is find organisms even at very low thresholds or low prevalence rates in the microbiotic composition. That means you may be seeing results showing low levels of things like overt pathogens, which may include C. diff, may include things like pathogenic E. coli, but it also may include conditional pathogens like H. pylori. And you may think, how could these things be positive so much? I'm not used to this. This is not what I was trained to see. Now, when we were trained, in most of us at least, when we were trained, and I think even people training today clinically are not really being properly instructed on how to deal with clinically and how to interpret some of these modern lab technologies. We are simply used to less sensitive technologies that missed a lot of things in the past that are now being reported, and we're having to figure out how to deal with them. With quantitative PCR, we find low levels of organisms and we choose to report them. Many of the other types of tests you may see out there, even some using quantitative PCR, but preformed kits that labs can just kind of buy and plug and play, they're only reported as positive or negative on an organism. And an organism to be reported positive on those kits has to be at a very high level or a high threshold that they agreed upon to get FDA approval for it, because the level has to be consistent with disease. But in functional and integrative medicine, we're not only concerned with disease, we're concerned with all the shades of gray getting to disease and clinical symptoms. So when we have low-level hits, and when we have hits, they are hits. The probes don't hit if the organism isn't there. We are choosing to report them to you. But we show you the level versus a clinical reference range, and it's up to you as the clinician to contextualize that information and decide based on clinical symptoms, antibiotic use, and other factors whether it actually needs treatment or not.